Regarding, everybody's concerns here about overspending. You yourself said that the Congress has found $500 to $700 billion in anticipated ways to save in our healthcare system. Why is it that we can't commit to making those savings first and then applying that to every page of this healthcare bill, which, if I'm correct, it's $1.2 to $1.6 trillion to implement this bill, and if my math is correct, that's $120 to $160 billion per page. So $500 to $700 billion a year. I mean, can we commit to proving that we've got these savings here? How do we fix? Can we apply them to Medicare? Medicare is going to be insolvent. I'm 40 years old, I'm a Gen Xer, and any Gen Xer will tell you that we're looking down the barrel of no Social Security when we hit retirement. Why is it that we've got all of these other issues? Can the Congress, can the Senate, can everybody prove to us that these savings are there before we pass a 1,000-page healthcare reform bill? You mentioned the bathwater and the baby before. Why throw the baby out with the bathwater? Why tear down the foundation of the healthcare system when maybe only the roof is leaking?
Well, thank you. I appreciate your question. I appreciate your question. I would challenge your claim that we're tearing down the foundation of our healthcare system when so many hospital administrators and physicians are supporting this plan. And the reason they're supporting this plan is because if this bill that I showed you passes, there will be $99 million in additional revenues coming to hospitals and doctors in the 1st District of Iowa that they're not getting paid for right now because they're already taking care of patients who don't have health insurance. And you know who pays for that? We do. Every person in this room pays a hidden tax of between $1,100 and $1,200 a year to provide health care for people who can't afford it, whether it's through increased premiums in their private insurance or increased taxes for Medicare patients. And you also raised the point about, why aren't there building more efficiencies into the system? Well, part of the problem is because we've seen a huge change in how healthcare is paid for in this country. And I'll give you some examples. One of the things I mentioned earlier is that in Iowa, 80% of all healthcare policies are sold by 2 companies. One of those is United Healthcare, which over the last 5 years has averaged profits of $3 billion. And what's happening is, as these for-profit insurance companies have to return profits to their shareholders in tough economic times, something's got to give. So what gives is that a lower percentage of the premiums they collect go to patient care, and a higher percentage goes to administration and payment of profits. And if you think that I'm making this up, think about this. The CEO of United Healthcare, one of the 2 top providers in Iowa, earns $13.2 million a year. He has almost $750 million in unexercised stock options that he could collect on right now. Plus, he had to pay back $190 million in stock options because the Securities and Exchange Commission found that he had gotten them through fraud. So if you want to know why we need to fix the healthcare system, that's part of the problem. And that's what I'm committed to doing.